Good day everyone, we are the Group 2 reporters of BSN 1F, and the topic that we're going to discuss is about the liver function test. This video discussion encompasses the definition of liver function test, total indirect bilirubin, albumin and total protein, normal results, and the diseases involved in liver function test. First, the definition. Liver function test is also known as a liver panel, or blood test that measures different enzymes, proteins, and other substances made by the liver. This test checks the overall health of your liver and measures the level of certain enzymes and proteins in your blood. These measurements give your healthcare provider important information about the overall health of your liver and how well it is working. Additionally, change in certain levels of proteins and enzymes can alert doctors of potential problems such as liver cancer, fatty liver disease, and hepatitis. Bilirubin, a compound formed by the breakdown of hemoglobin. Ammonia, a breakdown product of protein that is normally converted by urea into the liver before being secreted by the kidneys. Proteins that are made by the liver, including total protein. Test measures the total amount of two classes of proteins found in the fluid portion of your blood. Albumin, a protein made in the liver, and it helps in preventing fluid from leaking out of blood vessels. Prothrombin, a protein involved in blood clotting. And lastly, fibrinogen, a plasma protein that is produced in the liver and is converted into fibrin during blood clot formation. Cholesterol and triglyceride are also made and secreted via the liver.
These enzymes can help determine an area of the liver where damage may be taking place, and depending on the pattern of elevation, can help organize a differential diagnosis. How do liver function tests work? A healthcare provider draws a small amount of blood from a vein in your arm to test in the lab. They will look for abnormally high or low levels of different substances. Often, they'll want to compare levels of different enzymes or proteins to each other. If the balance is off, so that can help them understand better what may be going on in your liver. Liver function tests can also help determine if certain medications are damaging your liver or help you monitor the progression of liver disease. Depending on the test, either higher or lower than typical levels of these enzymes or proteins can indicate a problem with your liver. Some of the reasons liver function tests may be performed include screening for diseases such as hepatitis, monitoring the side effects of your medications, and examining the severity of liver disease.
It also includes some hepatic function panel evaluates the alanine aminotransferase, ALT, alkaline phosphatase, and aspartate aminotransferase. First, alanine aminotransferase, ALT, is an enzyme found in the liver that helps convert proteins into energy for the liver cells. When the liver is damaged, ALT is released into the bloodstream and levels increase. Second, aspartate aminotransferase, AST, is an enzyme that helps metabolize amino acids. Like ALT, AST is normally present in blood at low levels. An increase in AST levels may indicate liver damage, disease, or muscle damage. Third, alkaline phosphatase, ALP, is an enzyme found in the liver and bone and is important for breaking down proteins. Higher than normal levels of ALP may indicate liver damage or disease, such as blocked bile duct or certain bone diseases.
Now, let's tackle the total and direct of bilirubin, but before that, what is bilirubin? A bilirubin is a red-orange compound that occurs in the normal catabolic pathway that breaks down heme invertebrates. This catabolism is necessary process in the body's clearance of waste products that arise from the destruction of aged or abnormal red blood cells. If your bilirubin levels are higher than normal, it's a sign that either your red blood cells are breaking down at an unusual rate or that your liver isn't breaking down, waste properly, and clearing bilirubin from your blood. Bilirubin testing is usually one of a group of tests to check the health of your liver. Bilirubin testing may be done too. Investigate jaundice, a yellowing of the skin and eyes caused by high levels of bilirubin. The test is commonly used to measure bilirubin levels in newborns with infant jaundice. Determine whether there might be blockage in your bile ducts, in either the liver or the gallbladder. Help detect liver disease, particularly hepatitis, or monitor in progression. Help evaluate anemia caused by the destruction of red blood cells. Help follow how our treatment is working. Help evaluate a suspected drug toxicity. Some common tests that might be done at the same time as bilirubin testing includes: first is the liver function test, a blood test that measures certain enzymes or protein in your blood. Second, albumin and total protein. It is the level of albumin, a protein made by the liver. A total protein shows how well your liver is making certain proteins. These proteins are necessary for your body to fight infections and perform other functions. Third is the complete blood count. This test measures several components and features of your blood. Proton bind time. This test measures our clotting time of plasma.
What you can expect. Bilirubin testing is done using a blood sample. Usually, the blood is drawn through a small needle inserted into a vein in the bend of your arm. A small tube is attached to the needle to collect the blood. You may feel a quick pain as the needle is inserted into your arm. You also may experience some short-term discomfort at the site after the needle is removed. Blood for bilirubin testing in newborns is usually collected using a sharp lancet to break the skin of the heel. This is known as a heel stick. There may be slight bruising at the puncture site afterward. Your blood will be sent to a laboratory for analysis. You can usually return to normal activities immediately. Results. Bilirubin test results are expressed as direct, indirect, or total bilirubin. Total bilirubin is a combination of direct and indirect bilirubin. Typically, you'll get results for direct and total bilirubin. Typical results for a total bilirubin test are 1.2 mg per deciliter for adults, and usually 1 mg per deciliter for those under 18. Typical results for direct bilirubin are generally 0.3 mg per deciliter. These results may vary slightly from laboratory to laboratory. Results may be slightly different for women and children. Results also may be affected by certain foods, medicines, or demanding exercise. For this reason, be sure to tell your healthcare provider about your activity levels, as well as any food or medicine you've taken. Lower than usual bilirubin levels are usually not a concern. Higher levels of direct bilirubin in your blood may indicate your liver isn't clearing bilirubin properly. This may indicate liver damage or disease. Higher levels of indirect bilirubin may be a sign of other problems. One common and harmless cause of elevated bilirubin is Gilbert's syndrome, a deficiency in an enzyme that helps break down bilirubin. Your healthcare provider may order more tests to investigate your condition. Bilirubin test results also may be used to monitor certain conditions. What do the results mean? A bilirubin test measures total bilirubin. It can also give levels of two different types of bilirubin, unconjugated or indirect, and conjugated, direct. Very strenuous exercise such as marathon running can increase your bilirubin levels. Caffeine, penicillin, barbiturates, and non-steroidal anti-inflammatory drugs, NSAIDs, called salicylates, all lower your bilirubin levels. Lower than normal levels of bilirubin aren't a problem. High total bilirubin may be caused by anemia, cirrhosis, a reaction to a blood transfusion, Gilbert syndrome, a common inherited condition in which there is a deficiency of an enzyme that helps to break down bilirubin, viral hepatitis, a reaction to drugs, alcoholic liver disease, or gallstones. In newborns, high bilirubin levels may be a sign of blood type incompatibility between mother and child, lack of oxygen, an inherited infection, a disease affecting the liver.
What is albumin? Albumin is a type of protein that liver makes. The major blood protein produced by the liver that enter blood streams and keep fluid from leaking out the blood vessels into the other tissues. It also carries hormones, vitamins, and enzymes throughout your body. Albumin makes up more than half of the total protein present in serum. Approximately 30 to 40% of the body's total albumin pool is found in the intravascular compartment. The remainder is extravascular and is located in the interstitial space, mainly of the muscles and skins. Albumin is also found in the small amounts in variety of body tissues, fluids such as sweat, tears, gastric juice, and bile. What is total protein? Protein is needed to build and maintain muscles, bones, blood, and organ tissues. Protein circulate throughout your blood to help your body maintain fluid balance. Sometimes, when there is a problem with the liver, it can't make protein as well, so protein levels decreases. Liver function tests measure albumin, specifically the major blood protein produced by the liver, as well as the total amount of all proteins in bloods. Total protein and albumin or globin or the AG ratio test. A total protein and albumin globin or the AG ratio test measures the total amount of protein in your blood. There are two major types of protein in the blood, namely albumin and globin. Albumin, which is help keep blood from leaking out of the blood vessels. It also helps moves hormones, medicines, vitamins, and other important substances throughout the body. Albumin is made in the liver. On the other hand, globulins, which helps fight infections and move in nutrients throughout the body. Some globulins are made by the liver and others are made by the immune system. In addition to total protein levels, your provider may order a separate blood test for albumin and or a test for globulins. The globulin test is called serum electrophoresis. It is a blood test that measures the levels of 4 different types of globulins. This result may show the following. If a person has a low albumin levels, it may be a sign of liver disease, including cirrhosis, kidney disease, malnutrition, and thyroid diseases. But if a person has a high albumin levels, it may be a sign of severe dehydration and diarrhea. On the other hand, if a person has a low globulin levels, it may be a sign of liver disease and kidney diseases. If a person has a high globulin levels, it may be a sign of certain types of blood cancers, such as multiple myeloma, Hodgkin disease, or leukemia, hemolytic anemia, an autoimmune disease such as lupus, or rheumatoid arthritis, and tuberculosis. What do results mean? The result will show whether a person has a normal, low, or high total protein levels. They will also show if the person has a normal, low, or high albumin to globulin or the AG ratio. If If a person has a low protein levels, it may be mean a person has one of the following condition. First, liver disease. Second, kidney disease. Third, malnutrition, a condition in which your body does not get the calories, vitamins, or the minerals needed for good health. Last is malabsorption syndrome, a type of disorder in which your small intestine can absorb enough nutrients from food. Malabsorption syndromes include celiac disease and Crohn's disease. But when a person's total protein levels are high, it may mean that the person has one of the following conditions: an infection such as HIV or viral hepatitis or multiple myeloma, a type of blood cancer. Moreover, if a person's AG ratio was low, it may be caused by the autoimmune disease such as lupus, liver disease, including cirrhosis and kidney disease, and if a person's AG ratio was high, it may be caused by certain types of genetic disorders or leukemia. What does high protein and albumin mean? Albumin is a protein in your blood plasma. Low albumin levels might be the result of kidney disease, liver disease, inflammation, or infections. High albumin levels are usually the result of dehydration or severe diarrhea. But what does low total protein and albumin mean? Hypoalbuminemia is a condition where the body doesn't produce enough albumin protein that's responsible for keeping fluid in your blood vessels. The condition is ultimately a symptom of another condition. Treatment to address the underlying condition can improve albumin protein levels.
Normal result. Reference ranges vary from laboratory to laboratory and also depend upon the method used. However, normal values are generally framed by the range shown in table. Values for enzymes are based upon the measurement at 37 degrees Celsius. And these are the enzymes and its normal result. First, the alanine aminotransferase or ALT. Its normal result is 5 to 35 international unit per liter. And next, aspartate aminotransferase or AST. Its normal result is 0 to 35 international unit per liter. And third, alkaline phosphatase or ALP. Its normal result is 30 to 120 LALP. And next, the gamma glutamyl transferase or GGT. For male, their normal result is 2 to 30 unit per liter. And for female, 1 to 24 unit per liter. And next, lactate dehydrogenase. For 12 to 60 years old, its normal result is 100 to 190 unit per liter. And next, bilirubin. The total bilirubin is 0.1 to 1 milligram per deciliter. The indirect bilirubin is 0.2 to 0.8 milligram per deciliter. And the direct bilirubin 0.0 to 0.3 milligram per deciliter for newborn. And next, the ammonia. Its normal result is 10 to 70 microgram per deciliter. And last, albumin. Its normal result is 3.2 to 5.4 grams per liter. What can cause high bilirubin? High levels of bilirubin could mean your liver is not functioning correctly. However, high level can also be due to medication, exercise, or certain foods. Bilirubin is also a product of breakdown of red blood cells, and an elevated reading may be related to disorders of red blood cells and not liver disease. What are the symptoms of high bilirubin? With moderately high bilirubin, you may only have jaundice, which is a yellowish color in your eyes and skin. Jaundice is the main sign of high bilirubin levels. Abdominal pain or swelling, chills, fever, chest pain, weakness, lightheadedness, fatigue, and nausea. At what level is bilirubin a concern? The level of bilirubin that is harmful is around 20. Reaching a level this high is rare. High level need to be treated with Billy lights. To reduce bilirubin, stay hydrated. Staying hydrated helps low bilirubin levels by facilitating the removal of waste from the body. Consume fresh fruits and vegetables, avoid alcohol, and increase your intake of fiber.
Ammonia test. It measures the level of ammonia in a blood sample. Blood is drawn from a vein, usually from the inside of the elbow or the back of the hand. A needle is inserted into the vein and the blood is collected in an airtight vial or a syringe. These tests measure the level of ammonia in your blood. Ammonia is also known as NH3. It is a waste product made by your body during the digestion of protein. Normally, ammonia is processed in the liver, where it changes into another waste product called urea. Urea is passed through the body in the urine. What are the symptoms of high ammonia levels? Symptoms include irritability, headache, vomiting, ataxia, and gait abnormalities in the middle cases. Seizures, encephalica, coma, and even death can occur in cases with ammonia levels greater than 200 micromolecule per liter. High ammonia. High ammonia levels in the blood are most often caused by liver disease. Liver disease is the most common cause of high ammonia levels because it decreases blood flow to your liver. If there's a lack of blood flow to your liver, your body can transfer ammonia to it to be processed. This causes ammonia to build up in your blood. Other causes include kidney failure and genetic disorders.
What is a critical ammonia level? Ammonia is a very toxic, especially to the brain, and new research shows why. The glial cell's ability to remove potassium is first studied. This process normally takes anywhere from 2 to 6 weeks. What can cause high albumin? High levels of albumin may be a sign of dehydration, which may be caused by severe diarrhea or other conditions. If your albumin levels are not in the normal range, it doesn't always mean you have a medical condition that needs treatment. At what level is albumin a concern? According to UCSF Health, the normal range of albumin is 3.4 to 5.4 grams per deciliter, 34 to 54 grams per liter. However, the range might be slightly different for different drugs. If the albumin levels are above 5.4 grams per deciliter, you may be severely dehydrated as per Medline Plus. This may be due to causes such as diarrhea.
Diseases involved in liver function tests. As an additional knowledge, we were going to present some diseases involved in the liver function test. Acute liver failure. Acute liver failure, also known as fulminant hepatic failure, can cause serious complications, including bleeding and increased pressure in the brain. It's a medical emergency that requires hospitalization. Depending on the cause, acute liver failure can sometimes be reversed with treatment. In many situations, though, a liver transplant may be the only cure. Symptoms: acute liver failure can develop quickly in an otherwise healthy person, and it is life-threatening. If you or someone you know suddenly develops a yellowing of the eyes or skin, tenderness in the upper abdomen, or any unusual changes in mental state, personality, or behavior, seek medical attention right away. 5 causes of acute liver failure. Acute liver failure occurs when the liver cells are damaged significantly and are no longer able to function. Potential causes include acetaminophen overdose. Taking too much acetaminophen, Tylenol, others, is the most common cause of acute liver failure in the United States. Outside of the United States, acetaminophen is known as paracetamol. Acute liver failure can occur after one very large dose of acetaminophen or after higher than recommended doses every day for several days. Next, prescription medication. Some prescription medications, including antibiotics, non-steroidal, anti-inflammatory drugs, and anticonvulsants, can cause acute liver failure. Next, herbal supplements. Herbal drugs and supplements including kava, ephedra, skullcap, and pennyroyal have been linked to acute liver failure. Next, hepatitis and other viruses. Hepatitis A, hepatitis B, and hepatitis E can cause acute liver failure. Other viruses that can cause acute liver failure include Epstein-Barr virus, cytomegalovirus, and herpes simplex virus. Lastly, toxins. Toxins that can cause acute liver failure include the poisonous wild mushroom, Amanita flavoides, which is sometimes mistaken for one that is safe to eat. Carbon tetrachloride is another toxin that can cause acute liver failure. It is an industrial chemical found in refrigerants and solvents for waxes, varnishes, and other materials. Some cases of acute liver failure have no obvious cause. Complications. Acute liver failure often causes complications, including too much fluid in the brain, cerebral edema. Too much fluid causes pressure to build up in your brain, which can lead to disorientation, severe mental confusion, and seizures. Second, bleeding and bleeding disorders. A failing liver cannot make enough clotting factors, which help blood to clot. Bleeding in the gastrointestinal tract is common with this condition. It may be difficult to control. Third, infections. People with acute liver failure are more likely to develop infections, particularly in the blood and in the respiratory and urinary tracts. Fourth, kidney failure. Kidney failure often occurs after liver failure, especially if you had an acetaminophen overdose, which damages both your liver and your kidney. Prevention. Reduce your risk of acute liver failure by taking care of your liver. Here are several prevention methods for getting acute liver failure. First, follow instructions on medications. If you take acetaminophen or other medications, check the package insert for the recommended dosage, and don't take more than that. If you already have liver disease, ask your healthcare provider if it is safe to take any amount of acetaminophen. Second, tell your provider about your medicines. Even over-the-counter and herbal medicines can interfere with prescription drugs you're taking. Third, drink alcohol in moderation, if at all. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and up to 2 drinks a day for men. Fourth, avoid risky behavior. Get help if you use illicit intravenous drugs. Don't share needles. Use condoms during sex. If you get tattoos or body piercings, make sure the shop you choose is clean and safe. Don't smoke. Fifth, get vaccinated. If you have chronic liver disease, a history of any type of hepatitis infection, or an increased risk of hepatitis. Talk to your provider about getting the hepatitis B vaccine. A vaccine also is available for hepatitis A. Sixth, avoid contact with other people's blood and body fluids. Accidental needle sticks or improper cleanup of blood or body fluids can spread hepatitis viruses. Sharing razors, blades, or toothbrushes also can spread infection. 7th, don't eat wild mushrooms. It can be difficult to tell the difference between a poisonous mushroom and one that is safe to eat. 8th, take care with aerosol sprays. When you use an aerosol cleaner, make sure the room is ventilated or wear a mask. Take similar protective measures when spraying insecticides, fungicides, paint, and other toxic chemicals. Follow product instructions carefully. And lastly, watch what gets on your skin. When using insecticides and other toxic chemicals, cover your skin with gloves, long sleeves, a hat, and a mask.
Alcoholic hepatitis. If you're diagnosed with alcoholic hepatitis, you must stop drinking alcohol. People continue to drink alcohol face a high risk of serious liver damage and death. Symptoms. The most common sign of alcoholic hepatitis is yellowing of the skin and white of the eyes. Other signs and symptoms include abdominal tenderness, loss of appetite, nausea and vomiting, fever often low grade, fatigue and weakness. Malnutrition. It is common in people with alcoholic hepatitis. Drinking large amount of alcohol suppresses the appetite and heavy drinkers get most of their calories from alcohol. Additional signs and symptoms that occur with severe alcoholic hepatitis include fluid accumulation in your abdomen, confusion and behavior changes due to buildup of toxin normally broken down and eliminated by the liver, kidney and liver failure. Causes. Alcoholic hepatitis develops when the alcohol you drink damages your liver, just how alcohol damages the liver, and why it does so only in some heavy drinkers isn't clear. Other factors that can contribute to alcoholic hepatitis include other types of hepatitis. If you have hepatitis C and also drink even moderately, you're more likely to develop cirrhosis than if you don't drink. Next, malnutrition. Many people who drink heavily are malnourished because they eat poorly or because alcohol and its byproduct prevent the body from properly absorbing nutrients. Lack of nutrients contributes to liver cell damage. Risk factors. The major risk factors for alcoholic hepatitis is the amount of alcohol you consume. How much alcohol it takes to put you at risk of alcoholic hepatitis isn't known, but most people with the condition have history of drinking more than 3.5 ounces. 100 grams equivalent to 7 glasses of wine, 7 beers, or 7 shots of spirits daily for at least 20 years. However, alcoholic hepatitis can occur among those who drink less and have other risk factors. Other risks include your sex. Women seems to have a higher risk of developing alcoholic hepatitis, possibly because of differences in the way alcohol is processed in women. Second, obesity. Heavy drinkers who are overweight might be likelier to develop alcoholic hepatitis and to progress from the condition to cirrhosis. Third, genetic factors. Studies suggest there must be genetic component in alcohol-induced liver disease, although it's difficult to separate genetic and environmental factors. Fourth, race and ethnicity. Blacks and Hispanics might be a higher risk of alcoholic hepatitis. Lastly, binge drinking.
Having 5 or more drinks within 2 hours for men and 4 or more for women might increase your risk of alcoholic hepatitis. Complication. As you can see, this is how esophageal varice looks like. On the other hand, you can see the difference between normal liver and liver cirrhosis. Complication of alcoholic hepatitis, which results from severe liver damage, relate to scar tissue. Scar tissue can slow blood flow through your liver, increasing pressure in a major blood vessel, and the buildup of toxins. Complications include enlarged veins, blood that can flow freely through the portal vein can back up into other blood vessels in the stomach and esophagus. These blood vessels have thin walls and are likely to bleed if filled with too much blood. Heavy bleeding in the upper stomach or esophagus is life-threatening and requires immediate medical care. Second, ascites. Fluids that accumulate in the abdomen might become infected and require treatment with antibiotics. Ascites are not life-threatening but are usually signs of advanced alcoholic hepatitis or cirrhosis. Third, confusion, drowsiness, and slurred speech. A damaged liver has trouble removing toxins from your body. The buildup of toxin can damage your brain. Severe hepatic encephalopathy can result in coma. Fourth, kidney failure. A damaged liver can affect blood flow to the kidney, resulting damages to those organs. Lastly, cirrhosis. The scarring of the liver can lead to liver failure. Prevention. You might also reduce your risk of alcoholic hepatitis if you drink alcohol in moderation. If at all, for healthy adults, moderate drinking means up to 1 drink a day for women of all ages and men older than 65 and up to 2 drinks a day for men aged 65 and younger. The only certain way to prevent alcoholic hepatitis is to avoid all alcohol. Next, protect yourself from hepatitis C. Hepatitis C is an infectious liver disease caused by a virus. Untreated, it can lead to cirrhosis. If you have hepatitis C and drink alcohol, you're far more likely to develop cirrhosis than if you didn't drink. Lastly, check before mixing medication and alcohol. Ask your doctor if it's safe to drink alcohol when taking your prescription medication. Read and warning labels on over-the-counter medications. Don't drink alcohol when taking medication that warn of complications when combined with alcohol, especially pain relievers such as acetaminophen, Tylenol, and others.
Gilbert syndrome. Gilbert syndrome is an inherited genetic condition. You might not know you have Gilbert syndrome until it's discovered by accident. Such as when a blood test shows raised bilirubin levels. Gilbert syndrome requires no treatment. Symptoms. The most common sign of alcoholic hepatitis is yellowing of the skin and whites of the eyes. Other signs and symptoms include abdominal tenderness, loss of appetite, UC and vomiting, fever often low grade, fatigue and weakness. Malnutrition. It is common in people with alcoholic hepatitis. Drinking large amount of alcohol suppresses the appetite. The appetite and heavy drinkers get most of their calories from alcohol. Additional signs and symptoms that occur with severe alcohol hepatitis include fluid accumulation in your abdomen, confusion and behavior changes due to a buildup of toxin normally broken down and eliminated by the liver, kidney and liver failure, Causes: alcoholic hepatitis develops when the alcohol damages the liver and why does so only in some heavy drinkers isn't clear. These factors are known to play a role in alcoholic hepatitis. The body's process for breaking down alcohol produces highly toxic chemicals. These chemicals trigger inflammation that destroy liver cells. Over time, scars replace healthy liver tissue, interfering with liver function. This irreversible scarring is the final stage of alcoholic liver disease. Other function factors that can contribute to alcohol hepatitis include other types of hepatitis, malnutrition. How the body processes bilirubin. Bilirubin is yellowish pigment made when your body breaks down old red blood cells. Bilirubin travels through your bloodstream to the liver, where the enzyme breaks down pigment and removes it from the bloodstream. The bilirubin passes from the liver into the intestine with bile. It's then excreted in stool. A small amount of bilirubin remains in the blood. How the modified gene that causes Gilbert syndrome is common. Many people carry one copy in this gene. In most cases, the modified copies are needed to cause Gilbert syndrome. Risk factors. The major risk factor for alcohol hepatitis is the amount of alcohol you consume. How much alcohol it takes to put you at risk alcohol hepatitis isn't known, but most people with the condition have a history of drinking more than 3.1 ounces, 100 grams, equivalent to 7 glasses of wine, 7 beers, or 7 shots of spirit daily for at least 20 years. However, alcoholic hepatitis can occur among those who drink less and have other risk factors. Other risk factors include your sex, obesity, genetic factor, race and ethnicity, binge drinking. Complication. The low level of the bilirubin processing enzyme that causes Gilbert syndrome may also increase the side effect of certain medication. Since these enzymes plays a role in helping clear medication from your body. These medication include irinotecan or Comtosar, a cancer chemotherapy drug. Some protease inhibitors used to treat HIV. If you have a Gilbert syndrome, talk to your health care provider before taking new medications. Also, having any other condition that impairs the destruction of red blood cells may increase your risk of developing cholesterol.